to our November issue of Health Matters. This is our series, if you haven't joined us before, where we take a certain health topic every month and dive into it with an expert in that field. So November is Diabetes Awareness Month. So today we'll be talking with Dr. Ali Nasrallah, and he will be talking to us about all the different things we need to know about diabetes and what we should look out for and how we should get to be aware of all the things around diabetes. So Dr. Nasrallah, welcome to the program. Dr. Nasrallah is a family medicine specialist in Wayne County. So I'm going to pass it to him and tell us a little bit about yourself.
Hey, thank you, Matt. Thanks for having me on. It's a pleasure to be here. Thank you guys for all the work that you're doing to raise awareness about all of the important health topics. So I do work as a family medicine physician in Dearborn Heights on 25350 West Warren Street. It's right on Warren and Gully, so it's a nice, probably part of the heart of Dearborn Heights. I've been there for a year and a half now. We do family medicine. We also have an urgent care over on site, and it's just a pleasure to be able to work probably 4 minutes from my home. So really working in my community, and it's been a great time.
Perfect. Thank you so much. So let's start off with a really simple question. What is diabetes and what are the different types that exist?
Yeah, so diabetes is a disease where there is a bad imbalance of sugar in your blood, where it causes there to be an increased level of glucose inside your blood. And that can be caused by, and this is how you get diagnosed, whether it's type 1 or type 2, the main two types, where it's caused by either insulin resistance, where your body's not responding to a molecule that it releases to pull blood out, or when it could be where your body has an autoimmune condition where it doesn't produce insulin. And that causes your body to have too much sugar, and that's when you start having issues and end organ or problems in other organs in your body because of the hyperglycemia or increased level of glucose.
Great, thank you. So how would one go about getting diagnosed if they think they have something like diabetes? And what would be how common is it? And what are the symptoms that people might be seeing?
Sure. So those are all wonderful questions. When it comes to diabetes and diabetes screenings, this is why it's really important to follow up with your physician, because not only do we check for diabetes, but on your physicals, we also screen you for other causes of cancer and other diseases. But today we're focusing on diabetes. So diabetes can be checked in your blood. And there's 3 ways you can do it. So you can check a random glucose, which is basically when they poke your finger and they see where your blood level is. And, if that's over, I think the number is, if it's over 200, your random glucose. So it doesn't matter whether you've eaten or not. So if it's over 200 on at least 2 times, then we think, maybe you need to undergo more testing and you might have diabetes. And then the other way you can do it is you can do a fasting blood check. And if that number is over 126, so if you have a test at home and you test and it's over 126, you start to worry about diabetes. And the one that people are most aware of is the A1C. Arabs call it al-makhzun. So if you hear makhzun, that means the stored sugar, and that's a pretty good word for it, because that is the average glucose level and over about 3 months. So that kind of tells you where you're at. And that typically is, if you have an A1C level over 6.5, you're considered diabetic. Now, if you're between the other numbers people see is pre-diabetes. So for that, if you're between 5.7, 6.4, we see pre-diabetic. Let's make some changes to prevent a person from getting into the diabetic range. You had a bunch of other questions. If you want to remind me them.
Oh no, this is wonderful. Actually, I was, as I was listening to you, I wanted to ask if somebody's in pre-diabetes, what does that mean? So can that be reversed? And how would they do that if they wanted to do that?
So it's always best to start with lifestyle modifications, right? So medications should only be used pretty much as a tool when we're unable to do it naturally. That's one of my firm beliefs, unless we're trying to prevent something from happening. So with people with pre-diabetes, that's because their sugar level, they're eating a lot of sugar, they're getting a lot of carbs. There's probably a family history component of it, so they're increased risk of developing it. So they're going to get there if they don't change something, if they don't stop some of their bad habits or make some changes. So things you can do is, trying to exercise, at least 4 to 5 times a week for 45 minutes. It's a pretty easy goal we can set for ourselves for most people. Trying to watch what we eat. And we talk about diet when it comes to type 2 diabetes or diabetes in general. It's trying to limit your carbohydrate intake. And one of the misconceptions people have is they think, it's only about sugar and sweets. But no, your potatoes are very high in carbs. Your rice is very high in carbs. Your breads are very high in carbohydrates. Those all get broken down into sugar that gets released into your blood. So trying to limit your carbohydrates, trying to eat more veggie-rich diet, a more Mediterranean diet with vegetables and nuts and seafood, having more poultry without breading, so not fried. That's going to be your best bet for preventing yourself from getting to diabetes, or if you have diabetes, to control your sugar level. I hope that answers your question.
Yeah, that's a wonderful answer. So I think for a lot of us, it might be a little tough to give up all carbohydrates. So are some carbohydrates better than others, or are all carbs made equal?
I think it's an idea of living in moderation and uh, working with the hand that you're dealt, right? So, for example, it's important to recognize where people are from. People from South Asia are at a significant higher risk of developing type 2 diabetes, right? Middle Easterners are at a higher risk of developing type 2 diabetes. So recognizing if you have that family history, if your parents have it, you might have to work harder than than your neighbor or another person. And whether you have to give up carbs in general, I don't think that's the case. I think that, you don't need to eat rice and bread and potatoes every single day, right? So having days where, just like how you should have days where you're not eating any meat and it's more of a vegetarian days, maybe those days would be your complex carbs. So, eating more, whole wheat, whole grain, more of your lentils. Maybe those days that's what you can have, and then other days, you can have your proteins. So I don't say, and then what carbs you cut out is important, right? So cutting out junk food and pop and sweets, that's probably the route you should go first.
You mentioned complex carbs. So I
Yeah.
what could you explain a little bit what's the difference between complex and simple carbs, and what why might someone want the complex over the simple?
So complex carbohydrates are built by sugars that are grouped together in a different structure, right? They're strung together in longer chains. So your body is able to break them down into other sugars or shorter chains, and they can help keep you full for a longer time, as opposed to as the simple carbohydrates where you're going to get that sweet kick and you're going to be really happy. Here, let me pull up a list of some of the more common complex carbs. So this is a great picture right here. So your oats, your brown rice, your multi-grain cereals, your kidney beans, your quinoa, your green peas, or your whole bread, as opposed to like what you're gonna see in your white bread compared to your whole wheat, your white breads, your chips, your pop, your candies. So that's what you think of when you think of complex carbs. So think about your whole wheat, your whole grain. Um, so if you're gonna make a pizza or a pasta, maybe try the whole wheat pasta as opposed to, or now they have keto friendly pasta as opposed to, your regular pasta noodles, or your
Wonderful.
sweet potato as your white potatoes, your brown potatoes.
Wonderful. Yeah. Here at LHC, we say try to make at least half your grains whole grain. And that's just making that small step. But yeah, whole grains, I think, are a wonderful step in the right direction. Perfect. Thank you so much. So you mentioned this a little earlier, but how can exercise make a difference in the life of someone living with diabetes?
So exercise is a medicine for almost all chronic conditions we have, whether it's your mental health conditions that you may be going through or your physical conditions. Exercising allows you to um, burn the carbs down, allows you to decrease your sugar level, allows you to burn calories, and by doing so, your average glucose level in the blood will remain lower, causing you to live a healthier lifestyle, causing you to have improved blood pressure readings, improved cholesterol readings, improved sugar readings, and all of this comes together because the issue with the diabetes is that it causes when left untreated, it causes end organ damage. Um, so people have issues with, and this is where we have problems. People have issues with their kidney function, and now when you have kidney function problems, you go down a route where you will end up with maybe needing dialysis because you get chronic kidney failure. This leads to worsening blood pressure issues because now your kidneys aren't working well, so now you're not filtering your blood well. Now you are retaining fluids. Now your blood pressure is increasing. When your blood pressure increases, now you're damaging your kidneys more. Um, Now that issue leads to maybe chronic high blood pressure, which leads to potentially mini strokes, bad vascularization, poor blood flow, heart attack. So it really is all tied together. So that's why it's really important that we focus on our being healthy, maintaining a, uh, glucose level well below diabetes, and maintaining good blood pressure.
Wonderful. Yeah. So I think you alluded to this, but diabetes, having diabetes might be a you might be at higher risk of developing other issues with that. So not only is it a problem in itself, but it leads to other issues as well, correct?
Yeah, exactly. So, like we said, diabetes is associated with a bunch of issues, and it's like what came first, the chicken or the egg. Once you start going down this route, um, it really, really can become problematic, and the quality of life can really be impacted, especially in older patients. When you start seeing, so people with diabetes really should be checking their skin, making sure they don't have cuts on their legs. They should be having a diabetic foot exam. They should be having a yearly eye exam. So if you have diabetes, these are things that you should talk to your doctor about, and maybe trying to have a visit once a year just for diabetes. So as a physician, that's going to be my request is, a lot of times patients come in and they have, shoulder pain, multiple joint pain, high blood pressure, diabetes, cholesterol. That diabetes gets grouped in with everything else, and some of the stuff gets lost. But if you have diabetes, you need a foot exam, you need an eye exam. We need to review your medications, and especially if you're on medications, there's always new things coming out. There's always new drugs coming out, and we can speak a little bit about those as well.
Yeah. Would you like to share a little bit of like the medications? What's medications for diabetes might be, if that is the route that people choose to take?
Yeah, so the American Diabetes Association, the USPSTF, um, the American Heart Association, they all come up with guidelines for what the medications to use, how to treat them. The American Diabetes Association, in particular, reviews the endocrinology societies review the certain drugs we have, and they typically put up new recommendations. But things have changed. Honestly, it's really, really promising, and it really does make me excited as a provider. The how much information and research and new medications that are coming out with when it comes to diabetes. When you look at what was prescribed maybe 10, 15 years ago, that's probably now on the bottom of my list where I don't prescribe and I pull patients off of them. Like when you think of like your sulfonylureas, you hear people on a medicine called glipizide, those kind of meds, they're kind of leaving favor. But typically people will start off with a medicine called metformin, and now you have like the GLP-1 agonists and the SGLT2s, where you see those commercials for weight loss. Oh, Ozempic, Wegovy, Saxenda. These are diabetes. They were started off as diabetes meds, but we're realizing they're really good for weight loss. So you're seeing a lot of people on those. There's diabetes meds in that class that actually protect people's hearts, and kidneys, like Trulicity, Victoza. So I'm not going to get too much into the details, but there are meds that are out there now that are very promising. They're really working well. We're not having to start patients on insulin like we used to. So, I'm not really big on starting on insulin. I have a bunch of other options now. So if patients on insulin, to stop the insulin, to try switching and doing other drugs. But at the end of the day, and it really comes down to how invested is the patient, because you can do everything that you want, but if the patient's not going to try to make the lifestyle changes, then the medicine is just not going to work.
Yeah, definitely. I think that's one thing that we really stress here is the lifestyle changes are what's going to impact your health further down the line. Just those small steps each day, each week can lead to a really great result. Going back to just kind of living with diabetes, I just want to kind of bring it back a little bit to like what people might be dealing with. How often, if you're living with diabetes, should you test your blood sugar? And what should you do if it's too high or too low?
So it all depends where in the process you are of being controlled on a regimen, and what's important to you in your life. So I'm not big on constantly having people poke themselves unless it's really necessary. Once you're on a stable medicine, then maybe every 3 months to see where you're at, you can do the A1C to see the average. If somebody is titrating with insulin, though, that might be different. You need to know where their sugar level is before you give them some medications. So I guess it all depends on what treatment course you're on. It all depends on where you are in that process of being managed for diabetes. So I guess that my answer would be it depends, and they should really talk to their provider about that.
Definitely, yeah. Any sort of questions definitely need to go to like the primary physician that they see. Yeah. So one more big question that I have is, what age do you often see diabetes kind of set on? And what age, I mean, can you start to see diabetes? I mean, can you see it in kids or is it only in adults? Is it more common in adults or older people? Just when do you usually see it and when could it potentially show up?
So when it comes to type 1 diabetes, uh, that is more of a younger kid, teenager presentation, and that's the autoimmune one. The way that usually presents is it usually presents in a more severe case by case presentation, because typically what happens is these patients usually will have a really bad sickness or something that pushes them into ketoacidosis and they end up in the hospital. And then that's when we find out, why is this kid getting, or why is this person so sick? Why is their sugar? And then they check their sugar in their urine and they see glucose in their urine, and we check their sugar and it's through the roof, 500 to 1,000 or even more sometimes. So typically that will present with type 1 will present in younger kids. Type 2 can present at any age. Typically it's older people, but it can present in younger people if they have a really poor diet from birth and they're just constantly flooded with carbohydrates. But typically you'll see older people. The older you are, the higher the risk. Usually, I think probably around typical average you'll see in like the 40s and up, I would say. People with family history or medical history, people with symptoms, we might start testing earlier, but typically older people.
Gotcha. Thank you so much. So for type 1 with if that might be an early onset, whether that be childhood or in your teenage years, how might parents either look out for that or be care for a child with diabetes? Because you said they need to either there might be some big sickness that might show up, but what might be some early warning signs that you might, as a parent, want to look for or bring your child into a doctor and get them tested?
Yeah, so signs typically have to do with increases in the glucose. So usually polyuria, polydipsia. So people kids nocturia. So kids peeing a lot at night. Kids constantly saying they're always thirsty. You see this kid; he's always drinking water, urinating in their pants when they shouldn't be. They're at their age. So constantly thirsty, constantly peeing at night, peeing in their pants, constantly having to use the bathroom. Those are all signs, typically what you'll see with increased glucose. Then, your kid should be going to the doctor once a year. And at those physicals, that's when you bring up any concerns that you may have, if they're having constantly dizzy or what we just spoke about.
Wonderful. Well, thank you so much. I mean, this has been wonderfully informative. So I just want to thank you so much for taking the time out of your busy day and busy schedule to talk with us a little bit, and just give us some more knowledge about what we should be looking out for and what it's like living with diabetes.
We like to see you guys as your providers. We like to see you healthy. We like to prevent things. So if you are ever concerned, please don't hesitate to speak to your provider. Please don't hesitate to list your concerns. Say, ask, have you checked me for diabetes? Chances are your doctor did, but it's okay to ask and have them explain to you what they did. Don't get comfortable on your regimens of medications, right? So always ask, can I get off my medication? What can I do to get off my medication? Is there anything new out there that I should consider trying? Because science is changing, and we should always be constantly learning and changing as well. If you ever need anything, don't hesitate. Come by the family doc. We'll be happy to take care of you all.
Once again, thank you so much for your time. And thank you everyone for tuning in and watching. We hope you learned something or got some really good information today. And tune in for the next one.